Okay, so it looks like we've got some listeners out there really looking for some relief.
Yeah, definitely.
And they're ready to think outside the typical, drugstore ointment when it comes to anal fissures and fistulas.
I can't blame them.
They've sent in a bunch of articles about honey, even fasting, and a whole bunch of other natural remedies. So I guess let's dive deep into this and see what's actually, what actually works.
Yeah, it's really interesting to see people, exploring all these different options. I mean, these conditions can be really, really tough to deal with.
Oh, yeah, for sure. Like, incredibly painful. But before we jump into all these crazy remedies, I think maybe we should just, back up a second.
Okay.
And just make sure everyone listening, understands what we're even talking about here. I mean, everyone knows what honey is, right?
Right.
But maybe not, like how it could possibly help with, down there.
Good point. And we're actually talking about two different conditions here.
Okay.
So an anal fissure, it's basically a small tear in the lining of the anus.
Yeah.
And that can be, like you said, incredibly painful, especially during bowel movements. And, there's a lot of things that can cause them. Constipation, obviously, straining, or even trauma to the area.
Right, right. And then there are fistulas.
Yeah.
Which just sound like way worse.
Yeah, fistulas are definitely more serious. A fistula is basically a tunnel.
Oh, wow.
That forms between the end of the bowel and the skin near the anus. And usually this happens because of an infection.
I see.
And unfortunately, they very rarely heal on their own. So surgery is often necessary to really treat them effectively.
Wow. Okay. So two very different things, but both obviously pretty unpleasant. But the thing that really caught my eye in all this research, I gotta say, is the honey thing.
Yeah.
I mean, we've all heard of honey for a sore throat, but for this, it's just mind-blowing.
It might seem kind of surprising, but honey has actually been used for healing for, centuries. Yeah, yeah. And there's really a lot of science backing up, why it might actually be helpful in these cases.
Okay, you've got my attention. What is it about honey that makes it so special, down there? Is it just a matter of, slathering it on?
Well, it's...
I mean, is it that simple?
Not quite that simple,
okay.
But there are definitely a few different approaches people use. Basically, honey has this, really amazing combination of properties that make it a really powerful healing agent. So, first of all, it's naturally antibacterial. So that means it can help prevent infections, which is obviously a big concern in these areas.
Makes sense.
And then it's also anti-inflammatory. So, reduces swelling and redness.
Oh, right.
And on top of all of that, honey is incredibly moisturizing.
Right.
Which helps with tissue repair and just generally soothes the skin.
So like a triple whammy against pain and stuff?
Yeah, pretty much.
Wow, okay. Are we talking about specific kinds of honey, or will any honey from the grocery store do the trick?
That's a great question.
I mean, does it matter?
Research has actually shown that Manuka honey.
I've heard of that.
Yeah.
Is that the fancy expensive kind?
Yeah, it's a little bit pricier. It comes from New Zealand.
Oh, wow.
From the Manuka tree.
So it's imported honey.
Yeah, basically. And it has a really high concentration of this compound called methyl glyoxal.
Methyl what?
Methyl glyoxal.
Okay, I'm not even going to try.
It's a mouthful.
Yeah.
But basically, it has really potent antibacterial properties.
Oh, I see.
But even raw, unprocessed honey that you can find in most grocery stores can still be really beneficial.
Okay, so it doesn't have to be the super fancy kind.
Right.
So how do you actually use it? Do you just put it on there? I mean, I've even seen things about honey suppositories.
Yeah, there are a few different ways to go about it. One common method is just applying pure honey directly to the fissure or fistula after cleaning the area, of course.
Right, of course.
And then you can cover it with a clean bandage just to keep things in place.
Oh, okay.
Some people also mix honey with olive oil or beeswax.
No, interesting.
They're added benefits.
So what about the suppositories?
Suppositories are another option, and they offer a more direct way to apply the honey.
Right, to the source.
Exactly. So really it's all about finding what works best for the individual.
Ah.
And of course what their doctor recommends.
Yeah. Always good to check with your doctor on these things.
Yeah, absolutely.
But is there any actual evidence that honey is actually better than conventional treatments, for pain or healing or anything?
There have actually been some studies that have shown that honey can be just as effective or even more effective than some of the conventional antiseptic ointments.
Really?
Yeah, both in promoting wound healing and reducing pain.
Wow, okay.
But more research is definitely needed.
Yeah.
Especially when it comes specifically to anal fissures and fistulas.
So it's not like a guaranteed cure-all.
Right.
And definitely not for something as serious as a fistula.
Right. Exactly.
Yeah.
While honey can be really helpful in managing symptoms and helping things heal,
Right.
it's really important to remember that it's not a replacement for medical treatment, especially for fistulas. Surgery is often necessary to prevent complications.
Like what kind of complications?
Well, things like infection, even cancer.
Oh, wow. Okay, so definitely not messing around with that.
Yeah. Honey shouldn't be a DIY alternative to surgery.
Right. Well, that's good to know. And speaking of like different approaches, I'm actually really curious about this whole fasting thing.
Yeah.
It seems pretty extreme to me.
It can be.
But like the logic behind it is kind of interesting.
Yeah.
So what's the deal with fasting in these conditions?
Well, fasting, especially like water fasting or intermittent fasting, has become pretty popular
Yeah, I've heard of that.
for a lot of different health reasons.
Yeah.
And when it comes to anal fissures and fistulas, the idea is that it could really help reduce inflammation throughout the whole body.
So by giving your digestive system a break, you're also like letting your body focus on healing and repairing itself.
Exactly.
I mean, I know when I'm stressed or eating like crap, things tend to, flare up down there.
Yeah.
Could that actually be related?
It definitely could be. I mean, stress can definitely be a big factor in a lot of digestive issues. And fasting could help reduce some of that stress on your system.
I see.
And, by reducing the frequency of bowel movements, you're also reducing the pressure and irritation on the anal area. But you have to be really careful with it.
Oh, so it's not as simple as just skipping a few meals.
No, definitely not. Fasting should always be approached with caution
Right.
and ideally under the guidance of a healthcare professional.
Yeah, for sure.
And it's also really important to stay properly hydrated and maintain a high-fiber diet
Right.
to prevent constipation, because that can actually make these conditions worse.
Oh, wow. So it's like a delicate balance. Okay. So we've talked about honey. We've talked about fasting. But there's this whole other world of like natural remedies out there that people swear by. Like I've heard about olive oil, garlic.
Garlic, yeah.
I mean, where do we even begin with all of that?
It's true. There's no shortage of these remedies.
Right.
But it's really important to, be critical.
Yeah.
And to focus on the ones that have at least some scientific evidence behind them.
For sure. Okay, so let's try to sort through all that,
Yes.
all the folklore and figure out what's really legit. What are some of the, the most promising natural remedies out there for these conditions?
Yeah.
And what's the actual science behind them?
Right.
I think we were talking about olive oil and garlic, right?
Yeah, those are both really popular ones.
Okay.
And olive oil is a good place to start, I think.
Yeah. What about it?
Well, it's full of antioxidants, for one thing. And it has anti-inflammatory properties, which can really help when you apply it topically, to the affected area.
Right, so it's kind of similar to honey then.
Yeah, exactly. It's soothing and helps promote healing.
Okay.
But then there's garlic.
Oh, yeah, garlic. People put that on everything.
I know, right? It's like a miracle cure for everything.
But does it actually work for this?
Well, garlic is definitely known for its antimicrobial properties.
Right.
So, while we need more research, some studies suggest it might help prevent infections, which is especially important for fistulas.
Right, because those are caused by infections.
Exactly.
Interesting. So are we talking about eating garlic or putting it,
That's where things get a little tricky.
Okay.
Eating garlic can definitely boost your overall health, but putting it directly on, sensitive areas can cause irritation.
Oh, really?
Yeah, even burns.
Ouch.
And so it's best to talk to your doctor before you try that.
For sure. Better safe than sorry.
Exactly.
I've also heard about aloe vera, sage, thyme, even ginger.
Yeah.
Are any of those worth trying?
Those were all really common suggestions, and they have benefits, for general health.
Right.
But specifically for treating anal fissures and fistulas.
Yeah.
The scientific evidence just isn't really there yet.
So they might not hurt, but we shouldn't rely on them.
Exactly.
It seems like with all these natural remedies, there's always this need for more research.
Definitely.
Yeah.
And especially for these specific conditions.
Yeah, makes sense.
It's always best to talk to a healthcare professional, to figure out the best treatment for your situation.
For sure.
They can help you navigate all these natural remedies and make sure you're not putting yourself at risk.
Right, exactly. And that actually brings up a really important point. While we're exploring all these natural remedies, it's so important to remember that they are not a replacement for professional medical care.
Absolutely not.
There are times when you absolutely need to see a doctor, right?
100%.
Like, when would you say someone should definitely seek medical attention?
Well, if you're experiencing severe or persistent symptoms, for one thing,
Right.
or if you think you might have a fistula,
Yeah.
it's essential to see a doctor right away.
Got
Don't try to tough it out or self-treat,
Got it.
especially with something like this.
And I imagine there are even situations where, like, natural remedies could actually make things worse.
Oh, yeah, definitely.
Especially if you don't know what you're doing.
Right, like applying certain things directly to a fissure or a fistula,
Yeah.
things like garlic, for example, could irritate the area and actually delay healing.
Oh, wow. Okay.
So, again, always better to err on the side of caution and talk to your doctor.
Right. Check with your doctor before trying anything new.
Exactly.
Okay, so we've talked about the benefits of natural remedies, but what about prevention?
Oh, yeah, that's key.
Is there anything we can do to, like, lower our risk of developing these conditions in the first place?
Absolutely. One of the most important things is maintaining a healthy, high-fiber diet.
Okay, so like lots of fruits, veggies, and whole grains.
Exactly. Fiber helps to bulk up your stool and prevent constipation, which, as we've talked about, is a major factor in both fissures and fistulas.
Right, it all comes back to pooping.
Pretty much.
So what about water intake? I know staying hydrated is important for, like, everything.
Yeah,
But does it specifically help prevent these conditions?
it definitely does.
Really?
Yeah. Drinking plenty of water helps to soften your stool and make bowel movements easier.
Oh, right.
So there's less strain and pressure on the anal area.
Okay, so fiber and water.
Got it.
Two of the most important things.
Are there any other preventative measures we should know about? Like, what about those sitz baths I've heard about?
Oh, yeah, those can be really helpful.
Yeah.
Warm sitz baths can really help relieve pain and inflammation. And just maintaining good hygiene in the anal area is crucial, too.
Right, to prevent infections.
Exactly. So gentle cleansing.
Mild, unscented soap and warm water are best.
Got it.
Avoid harsh chemicals or scrubbing because that can really irritate the skin.
Right. It's a sensitive area.
Very much so.
It seems like we've covered a lot of ground here.
We have.
From honey and fasting to olive oil and garlic.
It's amazing how much information is out there.
I know, right? And it's fascinating to me how much, like, traditional wisdom there is about these conditions.
Yeah, for sure.
But I think what I'm really taking away from all of this is the importance of, like, listening to your body.
Yes.
And being informed about your options.
Absolutely.
What do you think?
I completely agree. The most effective approach often involves combining natural remedies with conventional medical care.
Right. It's not about choosing one or the other.
Exactly.
It's about, like, finding what works best for you and working with your doctor to make informed decisions.
I couldn't have said it better myself.
It just feels like there's still so much more to learn about all of this.
Oh, definitely. There's always more to discover.
And that's kind of exciting, isn't it?
It is. The more we research these conditions and explore different options, the better we'll understand how to prevent and manage them.
You know, as we're, like, talking about all this,
Yeah?
it makes me think about the stigma surrounding these conditions.
Yeah.
People often don't even want to talk about them,
It's true.
even with their doctors.
Yeah.
I mean, that can't be helping anyone get the treatment they need, right?
Absolutely not. There's so much, like, shame and embarrassment associated with these conditions.
Right.
And it can make it so hard to, like, seek help or even just talk about it with, loved ones.
It's like one of those taboo subjects that no one wants to touch.
Right.
But the reality is these conditions are more common than we think.
Way more common.
And there's no shame in getting help.
Exactly. These are medical issues,
Yeah.
just like any other health concern.
Right.
There's no reason to feel ashamed or embarrassed.
It's like we need to, like, break down those barriers. Yeah.
And create a more open, supportive environment.
Absolutely.
Where people can actually, like, feel comfortable talking about this stuff and seeking help.
Yeah, and sharing their experiences.
Right. Because how can we learn from each other
Exactly.
if we're not even talking about it?
Yeah, couldn't agree more. Open communication is key.
Yeah.
Both with healthcare professionals and, with loved ones who can offer support.
Right. That support system is so important.
It really is.
And that's where I think, like, online communities and support groups can be really helpful.
Oh, for sure.
They give people a safe space to connect with others who are going through the same thing. They can share information,
Yeah.
offer encouragement.
It can make a huge difference.
Yeah. Just knowing you're not alone
Right.
can be really empowering
Absolutely.
and validating.
It can help reduce those feelings of, like, isolation and shame,
Yeah.
which can be so debilitating. Totally. It's like when you know other people have gone through this and come out the other side,
Right.
it gives you hope.
Exactly. So to our listener out there,
Yeah.
if you're dealing with an anal fissure or fistula,
Mm-hmm.
you are not alone.
Yeah.
There are resources out there to support you.
Right. Online and in your community.
Exactly.
And remember, getting help is a sign of strength,
Yes.
not weakness.
It takes a lot of courage to reach out
For sure.
and advocate for your own health and well-being.
Well said. I think we've covered a lot of ground today.
I think so too.
Hopefully we've left you feeling empowered and informed.
That's the goal.
Remember, knowledge is power.
Mm-hmm.
And with the right info and support, you
Yeah.
can get through this.
Absolutely. Never give up hope. Healing is possible.
Yeah,
And there's a whole community out there rooting for you.
I love that. Thanks for joining us for this deep dive
Yeah, thanks for having me.
into anal fissures and fistulas.
It's been great.
We hope this has been helpful and insightful for you.
We'll see you next time.
Until next time, stay curious, stay informed, and take care of yourselves.
And remember, your health is your most valuable asset.
Couldn't agree more.
Take care.